Hello, my name is Caroline Steele, and today I am doing my informative speech about the duty of healthcare providers. Doug McConnell wrote an article titled Balancing the Duty to Treat with the Duty to Family in the Context of COVID-19 Pandemic. And his article really goes into the details about whether or not it is morally obligated to force these healthcare workers to work, or if it's morally obligated to not. So before we get started in the article and comparing the two, we have to first understand what COVID-19 is. In America alone, it has caused 1.9 million American citizens to get COVID-19. And across the world, it has caused 6.42 million people to get COVID-19. That resulted so far in 10,000 healthcare workers in getting COVID-19. Now, we have to ask ourselves, how exactly did COVID-19 become so relevant in today? Well, it's as easy as this. We have Taco Bell sauce. We have hot and mild and whatever else. We have Taco Bell sauce, and they're in a study room, they're just at Taco Bell, they're in a cafeteria, they're whatever. They're talking and they're socializing, correct? Well, one person talks. They come in and they just talk, right? That's it. Maybe they touch a pencil and everyone passes the pencil around to sign in or something, and they all touch the pencil, right? So now this person has COVID-19 bacteria on them, this person has COVID-19, this person and this person both have the bacteria in them, and then they go and they touch other things, and all this time they're spreading COVID-19. And that is an easy way to explain how crazy and how fast COVID-19 can spread. Now, according to Doug McConnell, right, he talks about how just all these healthcare workers isn't morally obligated to force them to work. He has two separate points. He talks about how the healthcare workers, they have families that are immunocompromised, and that it will lead to death in their family. But he also talks about people who have proper PPE and how they should be able to work and they should be fine without spreading it to their family members or to themselves. He also refers to the fact that 20% of healthcare workers can become infected with COVID-19, and they get these longer shifts that they have to work, and it causes more mistakes when they have to work these longer shifts due to the shortage of staff across the world in hospitals and other healthcare-related buildings. A main factor in this whole gray area is the fact that there are many hospitals and other healthcare related buildings that do not have access to proper PPE. The stats and the difference between people who have the proper PPE and the people who don't is astronomical. There are 1 in 1,000 chance of someone who has proper PPE that will catch corona, right? But there's a 1 in 200 chance of people who do not have proper PPE to catch COVID-19. And there was actually statistics done on a small population, and 82% said they did not have proper PPE. And that raises a question of, is it morally okay and obligated for these healthcare workers to work? He also talks about how in a retirement community in Spain, these healthcare workers just left because they could not there was not enough PPE to protect them and their families from contracting COVID-19 due to the fact that the retirement community had an outburst of COVID cases, and they just could not keep up with it. So there are 2 points that Mr. McConnell raises. He says, the first few, it is their duty to treat, it is their duty to uphold what they've promised, and that they should absolutely stay there for their patients and help in any way possible. Just as an example of if a child is drowning, should they go and save the child? Absolutely. But then there becomes a gray space of, is it safe for the person that's saving the child? Is it safe for them to go save the child, or are there dangerous conditions nearby? And then the second point he lists is that they have their own choices. They have family members. They have family members that they do not want, and if they work, they can't promise that it would keep the safety of their family away from COVID-19 and themselves safe from it. Some side statistics are 82% of people do not have access to proper PPE, 85% do not have access to COVID-19 testing immediately due to there's just not enough funding for it, and so if they're infected, they could be continuously spreading COVID-19 to other patients as well if they don't have the testing. And then 80% are not adequately staffed, so causing other health workers to get COVID-19 and just all around stresses everybody out. So his point overall is the fact that there are different ways to be morally obligated to be working during this time. One of the ways is, there are multiple ways. So the first way would be if your family has the immunocompromised, then it's morally acceptable to not work during that time. But if your family is not immunocompromised, then it is okay, it's morally okay, you need to be back at work. He agrees that during both of those cases, that compensation is morally okay to give since their duty is being done. Mr. McConnell agrees that during an epidemic, it is morally permissible for the healthcare worker to abstain from work when their duty to treat is outweighed by the combined risk and burdens of that work. So with people who live with their family, especially those who are immunocompromised, it is morally obligated, that is okay for them not to work. He also agrees that people who they're okay to work and morally that they should have more incentive to work, and to prevent staff shortages, it would help to have more incentives.